Hello, everyone. Thank you for joining us on another Wellness Wednesday episode with 3W. This is Helen. Again, if you haven't gotten used to my voice by now, but Wellness Wednesday is sponsored by 3W Medical, a medical clinic that provides free reproductive health care for services in the Seattle area. And today we're joined once again by our wonderful medical provider, Christi, and our wonderful executive assistant, Taylor. We're just going to continue our conversation from last week about vaginas. For our Vaginas 101 series, I hope you guys have enjoyed that because it's been really fun to record this. So to piggyback on last week's episodes, we talked about how, we talked about odors, we talked about cleaning down there, what not to do. This time, I think that we should build on that a little bit, and we're focusing on grooming practices, discharge, and what not to wear down there. So I'm going to start with our medical provider, Christi, grooming practices. What are your opinions, medical advice about our hair down there?
Well, Helen, thanks for having me on your show or podcast today. This has been a great topic for me. I work in between your clinic and then my family practice, and it's a question that comes up pretty frequently with women because they really don't know what's right and what's wrong or what's trendy. Everybody wants to be attractive and clean, but a lot of my conversations will happen when they come in and they have some irritation. Okay. So I can use this as an example at both sites that I work at, and frequently it's confusion about what's normal discharge and why they might have a particular irritation or a rash. And oftentimes what I find is there's just a knowledge barrier about what's normal discharge and what do we do with that discharge. Mm-hmm. And we talked about that more on the last episode. But as far as grooming, I frequently just tell women everything in moderation, just the same as how we eat or the things we partake in, whether it be things for fun, exercise, could be eating, it could be drinking. Everything in moderation is how I see the body being maintained at its best health. So for grooming, I'm not opposed to it. I don't have a lot of evidence-based information. I've done some research. I know I've sent you different articles.
Yes.
So it's really interesting to see that oftentimes it's just trendy.
Okay.
It's what's popular at a particular moment.
Okay.
And then I think it's ironic. I sent you another article, and I'm just going to kind of contrast on these articles because one went on about completely shaving or doing Brazilian waxing. And then in contrast, I found another article where a woman was losing her hair, whether it was from age or maybe there was an unidentified systemic illness. I have no idea.
Yeah.
But she was looking into having hair replacements.
That's so interesting.
It's so interesting because we have this situation where we're just not ever happy with what we have. Apparently, and we have to modify it somehow.
The grass is always greener.
Exactly. We think the grass is greener on the other side. So a lot of the issues with irritation and redness are things that women, I think, have caused in their zeal to be really clean, have great hygienic practices, and look attractive for their partner.
Yeah.
And so I always tell them, obviously I can just advise them, give them information, and I work and partner with them to make the best choice for them. But sometimes I'll see a topical dermatitis, so just an irritation. It could be a razor burn from shaving the entire area. It could be maybe something that onset a few days later or a week later with folliculitis, where you're introducing bacteria when you shave.
And what is that again, folliculitis?
So folliculitis is a inflammation, low-grade infection of the hair follicle.
Okay.
And so there's a couple things I'm just going to throw out right now that I'm thinking of. Always use sharp razors. Only use your razors. Sometimes people share razors.
Don't share razors.
But when you share razors,
it seems obvious, but
I know,
maybe not.
It seems obvious, I know, but on occasion we'll even have I've had men who might have shared a razor with a roommate and then they have a low-grade facial infection from their hair follicle. So
that.
No sharing razors. And sharp is better. Otherwise, you get this burn. Don't use, again, scented products.
Yeah.
I have to say, I would suspect that maybe a sensitive skin shaving cream might be more beneficial than shaving without a cream.
Okay.
And
is there a direction you should be going?
You know what? That's a really good question, Helen.
Whatever gets the hair off, I guess. That's the direction.
There you go.
I don't know. Like, it's a tricky spot.
It is a tricky spot.
So should it be wet or dry?
Oh, I would never do it dry. That sounds painful.
Yeah, I think probably wet. Like I said, with a shaving cream. Direction. Okay. Do you know what? I wonder if there's science out there on direction. I don't know that, I think the natural would be against the grain, per se. And then the problem is some people have more sensitive skin than others. So depending on their underwear and what they're wearing after, or are they exercising a lot? Is there a lot of sweat? Do they have skin folds? Are they lean? Are they heavy? There's so many different factors that funnel into this issue and can cause this local irritation. Okay. So with that being said, I just say, just do it in moderation. Okay. And I'm not opposed to people trimming or shaving. It's totally up to them. But if they come in and they're having issues with folliculitis, which then can sometimes cause hyperpigmentation because they have a little bit of a scarring that has to resolve over time.
I guess I'm confused. Can you describe to us what this how
folliculitis?
How will I know if I have folliculitis?
Is it bumpy?
It's kind of like a bump. It's like a zit. I guess.
So what's the difference between that and an ingrown hair though? Because you can have those and those kind of feel bumpy.
Yes, I would say if you have an ingrown hair, then you're going to be at risk for getting this inflammation of the hair follicle. Okay. And that's the problem with shaving. Everybody's at risk to then have the hair somehow get ingrown the wrong direction and then get this irritation. And then you have this inflammatory response. So then it gets swollen and then it gets red and maybe it resolves, maybe it gets infected. But in that process of healing and depending on your genetics and your immune system, you can either get more of an inflammation than another person, and then you can get prolonged bumps, and darkening of the skin is hyperpigmentation as a result from the whole process. And in the end, sometimes when I look at these people that have really extensive folliculitis or inflammation of their hair follicles, they would look better had they not shaved because it's pretty extensive. So, I understand the bikini line and things like that, but I just happen to believe that the hair is meant to be there, and there's a level of protection it's providing. Okay. Because it can be really sensitive for women when they completely shave the area. Okay. And I have a contrasting story. And a lot of what we learn as providers is based on science. At least it is for me. I really love research. I love to look things up. I want to understand why. I need rationale. But then we have to blend it with art and kind of common sense. Because a lot of things that we do as people in human nature, we want to make our life better, but sometimes we actually are the culprit causing the problem. Yeah. So it's interesting to think about it that way. But I have a friend that shared a story with me, and he had a patient who had to go through some chemotherapy. She had a rectal cancer, I believe. Wow. And she lost her pubic hair, and it became an excruciating source of discomfort for her. And it's nice when you have colleagues and friends where you can share little tidbits and stories to glean, because as a provider, a lot of my anecdotal knowledge comes from my patients' experiences that then I can relate to other situations and share with other women. So I feel like it's an important part of the normal human body to provide a barrier. Okay. And some sort of protection. And that's why I'm just everything in moderation. If you're going to Hawaii and you're going to go on the beach, trim up the pubic hair so that you look great on the beach. No problem. I don't really know what to think about waxing. And then, I'm sorry, Helen, the more recent one we were just talking about.
Sugaring. I was going to ask Taylor about it because I don't know much about it.
Honestly, I don't know a lot about it, but I can share with you a waxing story for sure.
I want to hear a waxing story because I have a waxing story and I am not into waxing.
No, it was, I did it in preparation for my wedding, actually, and it was painful. I mean, I do waxing on my face as well. It is a sensitive area, and I know that this might be horrifying, but my friend actually recorded the experience. And you just see my face. I'm just like, oh, this is so painful. But yes, it's nice because it's clean down there, and I think that the trouble I started having with it, though, I mean, other than it being pricey, is that as a working out, it kind of creates like the hair protects the sweatiness, and then it becomes sticky down there, and so that's been my experience. Mostly great, but you do have to be careful, because then you're, I'm sure, more prone to a yeast infection if you're like working out and you have nothing protecting you. But yes, I still have to groom down there because I think it's just, personally, I don't like hair anywhere except on my head, really. It's really just my own opinion. But, for the people who, want it down there, good for you. Because I wish sometimes I was more like that.
Do you know why, Christy, why the hair down there is different from the hair on our heads? Like the texture?
Do you know what? I feel like I actually read something about this just with hair and how it grows. There's another name for it on a science level, but I can't answer that. But
That's okay.
I'll look into it, and maybe we can talk about
put it
that
in
on another episode.
Yeah, because it's like the hair down there seems to be softer because maybe it's protected, and then the hair on our head is more coarse because it's more open to the elements. I don't know.
Well, and it's really, I'm sorry.
Go for it.
It's interesting because when we do pediatrics, and I had great instruction from a wonderful pediatrician in this community when I was doing my clinical rotations, and you will have kiddos get in gowns so you can take a quick look at their genitals and their bottom just to make sure that they're nice and healthy. And we'll do something called Tanner staging so that we know at what point they are in puberty, when we might expect breast buds, when we might expect menses, or the surge of hormones for males. And it's just kind of another way for us also to check that sex hormones and the endocrine system is functioning normally and people are developing. With the Tanner staging, you will notice when the pubic hair first comes in on a child, it's really, really thin, really soft. And actually, as we get older, it does become more coarse. And so it is interesting how that goes through. And I'm sure that there's a reason for that design. I couldn't answer it, but it does change over time. And that is a sign that you've progressed through the Tanner stages when your pubic hair does become more coarse.
Interesting.
Wow.
Out of curiosity, because it sounds like you've had to have this conversation with your younger patients. But, I have a younger sister, and I remember when she was like starting to get hair down there and the insecurity that she felt. So is there some sort of wise words you would give to older siblings or parents who are having to discuss, your body's changing, you're getting some hair, like how to approach that conversation so that there's not a lack of confidence from the child?
Yeah, or maybe even feeling self-conscious or embarrassed. I'll have some kiddos be like, oh my gosh, what? You have to look at my what? And occasionally I never want to make it uncomfortable. So I always say, we can defer this to the next year.
It's medical.
But if kids do it routinely at every check, then it's something that becomes more normal for them. And in the place of a doctor's office visit with a participating parent, you can have a really good conversation. And so I guess that would be my answer, Taylor, is if they're going to the doctor, it's nice to have that partnership and consistency with a provider that can kind of guide you through it, because then it's not something to be embarrassed about. It's something that's normal and it happens. And so for me, with my patients, what I find is that's the opportunity right there where I can start and help the parent, because sometimes parents are uncomfortable about it because I don't think they're equipped to talk about it.
Right.
And I'll just say, hey, this is Tanner staging. Why don't you guys look it up? Talk about it at home.
Wow.
Look at how your body is going to change and see what I'm talking about, because I want them to understand why I'm doing a check of their lower body parts or their private areas or genitals or whatever you want to refer to it as, so that they see that there's actually a reason behind it, that it's providing information. So I'll do a brief conversation about sex hormones and endocrine system and the stages of the Tanner. And sometimes when I've had really confused patients, I'll just pull it up. So I haven't accumulated all of my teaching tools, but that's a great tool. Just say, like, here's the Tanner stages. You guys can take this home. But I always encourage my patients, here's what it's called. Go home and research it, because I'd love to talk to you about it all day, but feasibly I cannot. And so making it a conversation with the family of it's normal, it's natural. And honestly, I'm kind of an advocate to keep some hair there, to not have folliculitis. Then you get inflamed lymph nodes in the groin. I mean, it's not just the cosmetic appearance of inflammation or inflammation of the hair follicles. I've actually had women who've accidentally cut then a folliculitis and they have a little scar or even indentation. So I mean, it goes all there's a great length, and sometimes no problem. People have no razor burn, nothing. It's just looks perfectly fine. But other people can be on another end of the spectrum where they're super sensitive and they have inflamed lymph nodes. And that might be what brings them in. Like, I have a lymph node in my groin and I'm not sure why this is. And then you look at their genital area and you go, wow, well, your skin is really irritated from whatever. But again, just having the conversation that it's normal. I like to incorporate stages of growth and development with my patients so that they see this is how it changes over time. You shouldn't be embarrassed about it. And then really equipping my parents to be able to talk to them about appropriate grooming in moderation. But I'm always talking about moderation, not just in grooming of the genital area, but in every area of life. You know, not too much sleep. The perfect amount of sleep, a balanced amount of sleep, but also balanced activity, engaging with people. We're meant to move. We're meant to have a purpose. We're meant to commune with people, eat in moderation, drink in moderation, things like that. So it's kind of my all over focus is just a simple life. Like Nora Jones. And I've said that before too.
Well, that's wonderful that you take so much time with your patients to educate them about that. And that's why we've been having these episodes. It's because we've been seeing a pattern of women in their 20s and even in their 30s not really knowing how to take care of themselves down there. And they come in with these, questions that should have been learned at a much younger stage, maybe from a parent or from a pediatrician. And there's just been no education about surrounding that. And then they keep getting their vaginas inflamed or, like stuff like that, irritated, and they don't know how to fix it. And then they put fragrances on it and, or like,
well, I learned in school how to put a condom on a banana, but I didn't learn how to avoid a yeast infection.
Thank you. Yeah. Or like sometimes we have women that don't know how to wipe in the right direction. And that's huge.
Even adult women later in life. I mean, there's deficits all across the continuum of age. It's amazing. So I think it's a great topic. I probably touch on it with every single patient. Yeah,
I think that's so important. And talking about more stuff down there, sometimes things end up on our underwear that we still don't know what it's called. And there's been a lot of emphasis on discharge these days. I've just been reading article after article about discharge. And I think the reason why there's been so many articles focusing on it is that women are finally comfortable talking about it. So, Christi, can you tell me, what is discharge? What is it made of? Why sometimes it feels like a slip and slide, and then sometimes it feels like tacky glue? Like, why is it like that?
Well, it's another fun topic I like to talk about. Again, I think it's because I didn't learn any of this growing up.
Me
either.
either.
I have to be honest. I
Yeah.
didn't learn it.
Yeah.
I didn't
either.
learn how to put a condom on a banana. So you're ahead of me there.
I ate my banana. I thought it was lunch, so I just ate it.
That's good. Oh my gosh.
Finally getting like a healthy snack.
Yeah.
Oh, it's not just pizza. We get a banana.
Yeah.
So with discharge, this is really interesting because I have lots of adult women that talk about this. So from, again, all age ranges. So I try and benefit my patients by opening up a conversation to just give them some basic information. And then I kind of segue into definitely letting them know what's normal, always inviting them to come back and talk about it because, again, I have to balance my information that I'm providing across the board, tailored to what their curiosities or their pressing needs might be. But in regards to discharge, again, it's a plan. It was planned in advance. And it's amazing because if you track it, and actually this FEM program
Yes.
that Lauren is doing
Yeah.
here, and
Yes.
I'm really excited about, I can't wait to have more information so that I can plug in some of my patients, because I have patients that really want to do birth control, but they have lots of hesitations.
Yeah.
And I won't get into details with that.
Yeah.
But it can cause weight gains and mood swings and acne or prevent acne. There's so many different things that it can do.
Mhm.
And so I think it's really interesting if you know the science behind discharge
Mhm.
and being able to track the patterns of your fertility. And so I'll start kind of with just what it's made up of. Basically, it's just fluid, it's turnover of cells. I love the analogy my OBGYN taught me, which is our female reproductive system is like a self-cleaning oven.
Mhm.
And gravity and being active and upright, it just descends from our female reproductive system, and we have discharge. And the discharge can be increased at different times of the month. It starts to increase as you get into the puberty time, and it kind of changes. When women or when young girls first get their period, it takes a while to work out the quirks and have that whole feedback loop with the hormones functioning appropriately where things are consistent. But as they go through the month, and it's really fun when I have young girls in now, they've always got their little smartphone out and they're all about pulling up their Menses app and telling me all about it and showing me their patterns. And
That's awesome that they're using it.
it's great. And so I encourage everybody to do that. And usually with the older women, I have to say, you need to talk to your daughter and get that app, because you need to track your period so you'll know more information. Because it tells us so much about our overall well-being. And when you have the cell turnover and as you fluctuate with fluid volume, that's basically all it is. And so if you track it through your menses, you can find out when your estrogen is higher or your progestin is higher. You can figure out when you're having your fertile time. And so again, this is another area you could probably spend a whole office visit or 2 or 3 talking about how to track your hormones and your fertility and your discharge. So I give them kind of the basics of just, this is typically when you're fertile, on what days of their menses, how to track it. A lot of the apps teach them this on their own, but being more familiar, because sometimes they'll think something's wrong with them because their discharge has changed. So I can think of a few instances where I've said, no, it's just changing because of whatever reason. We'll look at the calendar, we'll figure out where they are in their cycle, and it's typically driven by hormones.
Right.
And then we know when something's wrong when it changes from the overall norm of a kind of white discharge. It's called physiologic leukorrhea. And again, it's just going to change from being more watery to maybe more of a creamy white to then that sticky egg white that you're talking about.
That can stretch up to like a certain measurement too.
Yeah,
like
it's amazing. And so we'll talk about that. And then I talk about not putting anything down there, like applying or feeling like you have to cover up a scent or the discharge.
It makes it worse.
It makes it worse. And a lot of times women are like, I want the discharge to stop. And I'm like, you can't stop it.
It means your body's working.
Yeah.
That's a good thing.
So I try to reinforce that it's natural. You shouldn't be concerned. You shouldn't be self-conscious. Don't feel like you need to douche. And honestly, I'll have frank conversations because some of it will be surrounded around relationships and them not wanting to gross out their boyfriend or whatever. Yeah. And so we have to have a good sense of humor. And I'll just say, if it's meant to be, he's just going to love the discharges. So, it's just there. It's got a purpose. And also you can have, and I want people to have open conversations with their partners and that it is normal and have a conversation with your significant other, your husband or whatever, about the discharge if it becomes an issue or if you have a concern, because it's totally normal. And that's what I'm trying to reinforce so that they can just lose that worry and then enjoy what's more pressing, which can be work and family and just enjoying life in general. But on the other side, when it changes and it becomes a different color or it has an odor or their menses is changing somehow and they have irritation, then I talk about how it's a sign of imbalance in health. So
what would the differences be? So, I mean, either way, we're going to get the discharge and we're going to get like maybe some of the odor. So what is the turning point where you think to yourself as a provider, oh, this is not really what I should be seeing from a healthy body. This is something else, in which case an individual should then look for more medical advice.
That is such a good question, Taylor, because often women will think, oh, this is that yeast infection that's thrown out pretty popular among women or on TV or whatever. I don't watch television, so it's amazing how inundated people get with prescription information on the television, and I feel like I deal with that a lot with people coming in. Oh, I want this, I saw this, I want this. And
like Monistat or something like that?
Well, it can be Monistat or any other drug, but it's interesting. So people will often talk about, well, I've just treated this yeast infection for years and it won't go away. And then what we later find out is that it's maybe not a yeast infection. So I will actually plant that seed in my conversation somewhere of saying, if you have a change from the baseline physiologic leukorrhea, meaning everybody's going to have a certain smell.
Yeah.
It comes from your apical gland, or I can never say this, but I'll have to look it up. But we'll put it on the list. But anyways, basically your sweat glands. We all have a scent, and some people might call it musky, but it will make an odor along with the turnover of the bacteria or not the bacteria, but the cell turnover and the fluid that's coming out with the discharge will take on an odor. And if that odor changes dramatically, if the discharge is thinner, watery, if it's chunky, things like that, that's what I kind of tell women. So it's usually more of an odor and texture change.
Yeah.
So those are basically the two things that I say. And then I talk about the vaginal microbiome, just the normal bacteria that occurs naturally in balance in the vaginal area and how that can become imbalanced to become a yeast infection, but how it's important to have it assessed, at least to get a baseline confirmation of, yes, this is yeast. Teach the patient, then maybe they can go forward and self-treat with an over-the-counter. But if they have several new partners or even one new partner or something, or maybe some antibiotics.
Kind of throw things off.
You really want to help that woman discern, yes, this is characteristic of yeast. And then moving forward, they're usually equipped to manage it on their own. But in the chance that it's something like bacterial vaginosis, or
we get a lot of that.
Or we get a lot of bacterial vaginosis. It could also be maybe something else is going on, an STI. And so those things are really important not to ignore. And I see this pattern of women wanting to constantly treat something, and it can go on for a while. And so you really want to have it assessed to be sure. Because there's quick, easy tests that we can do.
Yeah. So pretty much, if you have a concern about it, just come in and see one of our medical providers.
Exactly. But also what I'm hearing is that, like, this is why tracking, discharge is so important.
Yeah.
And I know that, I know that the FEM app does that, and there's probably others out there, but tracking your discharge is important, because I know for myself, actually, at 26, I caught my first yeast infection when I was able to identify it, because I had been tracking so long what discharge looked like. And then this was out of character. It was not the right time of the month.
Mm-hmm.
It was different. And so as a result, I was able to think that clearly there's something going on here that shouldn't be. Really wasn't concerned about it being an STD, because I have a husband. So I was like, yeah, this is not normal discharge, and it's not at the right time of the month.
Yeah.
I should be, quote unquote, dry.
Yeah.
And sure enough, 26, I'm finding out that you can still get a yeast infection for the first time.
That's really cool that you were able to listen to your body, though.
Yeah.
And be like, there's something wrong. I need to go get this checked out. And you were able to feel empowered to do that versus, I don't know, putting something on it or
trying to cover it up.
Yeah.
Like, I've had women that have had BV for months, you guys, like 6 months.
Oh.
And all they're doing is trying to cover it up.
Doesn't it burn?
Yeah, they're really, but they just tolerate it, and they actually kind of get depressed because they're like, what is going on with me? And several treatments of over-the-counter yeast is not going to treat BV.
Right.
So I love hearing that story too, because it just shows how educational it is, because you are equipped with the education and an app to apply and use your knowledge to go, hey, this is out of norm and I need to go check this out.
Yeah.
So, and that's what it is it's just giving women the tools and the knowledge so that they can take care of their bodies and enjoy life. Mm-hmm. That's the basic goal.
Well, and if you come to 3W, the tools are free.
Yeah,
they are.
So there's just everybody wins.
Yeah, Dr. Ethelford has even brought patients into the lab to look at their own yeast.
Yes.
It's a great experience.
It is so fun. Did you get to do that?
I did. It looks, in the microscope, it looks like this little tiny strand of hair almost.
Yes.
But sure enough, it is yeast. And she will identify it, and she'll get super excited because she's diagnosed you right then and there. Go get your prescription. Have a great day.
Yeah. And it's funny because the microscope, and they call it microscopy, when you're able to do that at the bedside, that's a really unique service to provide to women. So that's an advantage also here at the clinic.
Yeah.
It's usually really a generational thing. And again, with the way medicine is, we just don't have time to mount a slide, go turn the microscope on, prep the slide, and then look into it. When you think about it, we could and save tons in healthcare dollars,
insurance,
by doing that.
Yeah.
So here, the services are free. It's an amazing clinic providing the services that we do. But on top of that, we can send out to confirm by lab, but we can also look in the microscope. So that is really, really awesome.
Yeah.
And it is. It's kind of it's a different approach to medicine because of the time that we're allowed to spend with patients here at 3W, we can go beyond the normal education and look under a microscope.
I think for a patient, it takes away the mystery and eases the anxiety. Like, let's just look on the microscope together. I'm going to educate you. Here's a prescription. It's going to be okay.
Yeah.
You know, we're doing this together. I'm not going back into some mystery lab and concocting something to, I want to give you answers and be very transparent with what I'm seeing.
Right.
Yeah.
And I think that's really empowering for patients, especially young patients, to be like, I want to see it.
Yeah.
I want to know.
And that has happened a lot where patients they're thrilled to see it because you're inviting them into a conversation about their health care.
Yeah.
You're not really going to get other places.
Yeah.
So it's a wonderful experience.
Yeah. Very unique for sure.
Yeah. All the staff here loves going to our medical providers. It's one of the perks of working here. So, okay. One last topic is, I guess from the both of you, what do you recommend that women not wear down there?
So for me, I am all about cotton.
Okay.
Just cotton, if you could do cotton.
Okay.
I had a lot. I just was flooded with a really interesting case that I'm dealing with right now. And it's actually a woman post-menopausal with issues with discharge, and it's really pressing on her. It's really bothering her. And one of the things that I suggested she do is don't wear any underwear to bed.
Oh, to bed.
Yeah.
Okay. I was like, during the day?
All day.
Oh my gosh, Helen, that was so funny, your expression. I was like, oh wait, I mean, to bed. Minor detail. So anyways, actually, and I had a really fun lecture when I went back to grad school to become a nurse practitioner. And she ended up specializing in OB/GYN. And her philosophy also was just don't wear anything to bed. Wear a nightgown, whatever. Obviously, we're not going to walk around our houses naked with our children.
Yes. But use prudence.
Yeah, use prudence. But it's the one and only opportunity to have a real big window of time where you can just kind of leave things natural.
Yeah.
And you can wear boxers around the house as an alternative to underwear. I've had women complain of their bottom being sore from wearing what some people call T-backs or G-strings or the limited underwear to, again, this is in their zeal to look good in pants and not have panty lines. So I don't really, I don't care what underwear people wear. I really don't. It's their choice. We have the free will to choose our underwear. But I do know for a fact that cotton underwear is going to breathe better.
Yeah.
If you're having situations where you might be really sweaty, and that can be different periods in life. It could be when you're going through menopause where women get really warm and hot. Then sometimes I will tell them to get a panty liner. And this is really another interesting conversation. It kind of crosses everything we've talked about because sometimes women are bothered by the discharge on their underwear.
Sure.
That typically doesn't happen too much until they've gone through puberty. And then it's, I would say, minimal. But then after they have a baby, and this is a little change, but after they have a baby, and if you can do a quick visual of maybe a woman lying on her back and you can see the vaginal orifice or opening, and then behind that, towards her back, she's got her opening of her anus. There's skin or a bridge in between that, right?
Yes.
And that's called the perineum. So when you have a baby and go through the pregnancy and then the delivery, that bridge or perineum of skin shortens.
Oh.
And so discharge is going to often increase, or our bodies just don't hold it back as they did before.
Because the opening is bigger?
Because the opening not necessarily is bigger,
or
but
more relaxed.
That skin is shorter.
Oh.
And things change. It can be a little bit bigger opening. It can change. The body's amazing, you guys.
Yeah.
Amazing design.
Yeah.
Okay.
Yeah.
It just, things bounce back. It does amazing things after we have babies. So it's not to say that life is over after you have a baby. It's just to say if you have an increase in discharge, sometimes it's related to that whole life transition and experience. And some women after they have babies might not have that. But just it's an area that I find that I have touched with women. Well, why do I have so much discharge now after I've had this baby? And my quick thought and common sense answer is going to be, well, after you have a baby, that perineal bridge changes a little bit. Discharge is not held back the same. And over time and with gravity, it will probably progressively continue if you can think about our bodies and gravity and how things kind of fall south, say. And so I just advise them, just put a panty liner on.
Yeah.
Who cares? Just put a panty liner. And for me, that is going to wick away moisture, especially if I have a woman that's complaining about it with working out at the gym or having hot flashes, or even after you have a baby, you've taken on so much extra fluid volume, you sweat for like weeks after you have a baby to get rid of all of this fluid. But the amazing thing is the body knows what it's doing.
Yeah.
There's a purpose behind most things that our body does. And I guess that is what you're talking about, Helen, removing that mystery so that women have more confidence
Mm-hmm.
and can kind of let that go and be confident in their bodies and themselves
Right.
and in relationships.
Yeah.
And so I will say the other thing about panty liners is I've had women who do shave and have irritation. And so you have to kind of rule out one variable versus another. Is it the shaving? Is it the waxing? Is it the underwear? Or is it the panty liner? And so I've had conversations with women too, honestly, and this is hilarious, but I'm like, have you heard of Kotex Light Days? I mean, this is not a commercial, but it's a basic panty liner. And there's so many different panty liners, and I'm not going to mention any names because I don't want to say anything bad about some brands' panty liners, but there are some that have more plastic-like component to it, and that's going to hold moisture in. And the Light Day, actually, I was looking at it in the grocery store the other day, and on the box, it actually says dermatologist recommended.
Okay.
So it wasn't just my thought. It's actually reinforced on the box. It's simple. There's not a lot of plastic. It's cotton.
Yeah.
It pulls away the moisture.
Okay.
And if you're bothered by your discharge or you have more because of your hormonal fluctuation or whatever, it's great for wicking, but also changing your underwear frequently. Don't stay in wet underwear if you're working out. Common sense things like that. So
yeah, we've heard Dr. Rutherford say, like, you should take a shower after you're working out.
I feel like that there's sometimes with certain name brand clothing, workout clothing, they're like, oh, you can just like wear it all day, athleisure, and it's, you know, built so that you don't have to maybe shower right after a workout. Yeah, and I'm just...
I feel like I earned a shower after getting all sweaty like that.
Our providers here, I feel like they're very much about like, let the vagina breathe.
Yes.
Yeah.
Let it breathe.
Yeah.
Like Sue will, or Dr. Rutherford will even say, you know, let it breathe after the shower.
Yeah.
I mean, so I'll usually walk around in my robe for a good like 30 minutes. Just let it breathe.
Let it dry. Let it air dry.
Air dry, yep.
Yeah.
I'll even say use the hairdryer.
Yeah.
On the counter.
Yes.
Because I also will have patients, as part of the irritation, they'll get yeast.
Yep.
A skin yeast or something that they're dealing with. So it can get really complicated down there. And the best thing is to not try and cover up the scent. Don't use scented products. Don't wash inside the vagina. Using a mild soap with a very mild scent is fine, but you're not supposed to put anything in because it's going to throw off that microbiome or the normal balance of bacteria. And so, you can do blow, but, you know, I'm always really careful because you never know how people perceive information. So again, I just want to say with the hairdryer, it's like a couple feet away.
Keep it away from you.
Yeah, please don't put it right up there.
You know, some people are in such a rush, and Taylor, this kind of goes off the leave your workout clothing on all day because they market it as being breathable and wicking moisture away. There's also been people that come in that constantly wear their yoga pants or whatever because the American dream is let's just do as much as we can, as quickly as we can. And so oftentimes people won't take the time to just say, you know what, I deserve a quick 10-minute shower and a 5-minute blow dry. You know? So,
well, it's such contradicting messaging. You can do all of this, but then you also have to do self-care.
Right.
Where does that fit in?
Exactly. Where does self-care fit in?
Yeah.
That is a big, big issue.
Yeah.
Even
especially
like
for women.
Yeah. With women. Exercising, taking time to taste your food, not eating it standing up, enjoying your coffee while it's hot. You know, it's a big deal.
Well, I think all of this comes down to, are you doing all of this grooming, wearing these type of underwear, worrying about this discharge? Is it for you or for someone else?
That's a really good question.
You know, who are you really pleasing at the end of the day? Who are you trying to make it smell good for the end of the day when it's supposed to just smell like you?
Right.
Yeah.
Yeah. So, all right, ladies, we are way over time. But that was so much fun. And as listeners can tell, we can just go on and on. Our bodies are so complex and it's awesome and it's beautifully made. So we're going to have to wrap this up. If listeners would like us to go on, we will make a third episode, but you got to let me know. So there's always so much to talk about. Let us know what you think about these topics that we're talking about, visit our website at 3W Medical. Thank you again, Christi, for your time and your wisdom and everything in moderation, people.
Yes.
A simple life.
Yeah. And here at 3W, like we've been saying, we provide free reproductive health services. We approach women's healthcare from a holistic, patient-centered type of care. Come in if you have questions, if you're just interested in continuing this conversation with our medical providers, or even with me and Taylor. We'll kind of tell you what we've been doing, but please make an appointment. And you can find more information about us on our website, which is 3wmedical.org. That's the number 3, letter W, then medical.org. And if you like what you're hearing on our podcast, again, visit our website, share it with folks, share it with your girlfriends, or even with your husbands so they can appreciate what your bodies are going to, ladies. So until next time, stay healthy and be well.